Hello, I've created a short little video where I go over the blood vessels with you. Hopefully, as I explain them, it will help you link the words or the location with the name, making it a little easier for you to remember, because it looks really tricky, but most blood vessels are named on their area. So let's have a look at the blood vessels. So this is on page 327, and it looks at the systemic circulation. Remember that we're talking about arteries now, and arteries go away from the heart. So when we start, we're going to start at the left ventricle of the heart, and the blood will be coming out and going to the body. The first thing it does is it goes up. So this is the ascending aorta. Then it turns, which is the aortic arch. Then it goes down, which is the descending aorta. As the descending aorta goes down, it goes through the thoracic area. So then it's called the thoracic aorta. The abdominal area, so it's called the abdominal area, aorta. And then it bifurcates into the left and right common iliac arteries. And if you put your hands on your hips, you'll go over the iliac bones, which is the top of your hip bone, and the bifurcation occurs about the iliac artery. Good. So that is the aorta. As the blood comes out of the heart and goes over the aortic arch, you have three blood vessels, which are named alphabetically, which helps. The first one is B, C, and then S. The first one that comes off goes to the brachia, which is the arm, and the cephalic area, which is the head. So the first one coming off is the brachiocephalic artery, brachial arm, cephalic head. The second one is the carotid artery, and it's the common carotid. It goes up the neck and then divides into internal and external. Then the next blood vessel that comes off goes underneath the clavicle. Clavian is clavicle, sub is underneath. So BCS, brachiocephalic, carotid, and subclavian. If it is labeled on this diagram, it is testable. Okay, let's continue on with the other principal arteries. So we are going to go down the arm. So here is our aortic arch. The third branch that comes off the aortic arch is the subclavian artery, and it's going to go under the clavicle and down the arm. Then the part that goes into the armpit, axillary artery. The part that goes onto the top part of the arm, branchial artery. And this is the branchial artery. This is where you take a blood pressure on. Then over the radius, which is the top bone here, that is the radial artery. So subclavian, axillary, branchial, and radial artery. Okay. Then if we go down the aorta, we have the thoracic aorta, which then goes into the abdominal aorta. The abdominal aortas are named after, or the abdominal vessels are named after the organ they feed. So I will make sure if I do give you any abdominal arteries, they will have the organ attached. So the liver is hepatic. So the one that goes to the liver is the hepatic artery. The one that goes to the spleen, splenic artery. The one that goes to the stomach, gastric artery. Okay. Then kidneys are renal. So that's the renal artery. Then there are two blood vessels that will feed the guts. You have the superior mesenteric, which comes off the top and feeds the small intestine, first part of the large intestine. Then the inferior feeds the large intestine. Good. When we come down the aorta, the descending aorta will then branch at the hip of the iliac, forming the iliac arteries. Then it comes down and it divides into the internal iliac and the external iliac. Then over the femur, it's the femoral artery. Near the back of the knee, it's the popliteal artery. Then The tibia has one on the front called anterior, and on the back is posterior. There is a loop down by the foot. Dorsal means back, pedis is foot, so it's the back of the foot artery. Now, one of the vocabulary words we'll talk about later is anastomosis. And anastomosis is sort of a loop of blood giving more than one direction for the blood to flow. So if there were some pressure on your legs, it could come down the the superior, or it could come down the tibial, anyway, posterior, anterior tibial, and it forms a loop here. So it is a beautiful example of anastomosis. So again, if we go back to descending aorta, then you have common iliac, external iliac, femoral, popliteal, and then your anterior tibial, your posterior tibial, and your dorsal pedis artery. Again, if it is on this diagram, it is testable. Next, we will look at veins. Before I get to veins, one more example of a beautiful example of anastomosis. You don't need to know the names of this, but if you look, this is the underside of the brain. It is very important that your brain gets oxygen, so there's more than one pathway to get blood to your vein. You can do this one or this one, and then this really cool, it used to be called the Circle of Willis, which to me was a cool name, and now it's all these communicating. Anyway, you can see how they are thin, they're branches, they're bends, so if there is a clot, it could get stuck in the clot. This, don't worry about the naming of these, but this is a beautiful example of anastomosis, which is more than one way to get blood to cells. We will look at the principal veins on page 330. Now, I want you to remember that veins collect blood from the body and go back to the heart, but it's easier for me to remember if I start from the heart and go out backwards, basically. So if we look at the heart, there are two blood vessels that feed the right atrium, and that is the superior vena cava, and then below it is the inferior vena cava. So the inferior vena cava goes down and collects blood from the body. Let's focus on the superior vena cava. The superior vena cava, first division is goes to the head and arm, so it's called brachiocephalic. Then it goes underneath the clavicle, so this is the subclavian vein. In the armpit, axillary, and that's all you need to know on that side of the arm. If you go on this side of the arm, this one doesn't make much sense to me, unfortunately. If you go down, you've got the internal jugular, which drains the head. Then the subclavian will divide into the cephalic, which is the top part. I kind of think of cephalic as in head, and it divides off at the head of the humerus. And then the basalic, which goes at the bottom part of the arm, and they will collect blood at the cubital, the median cubital. And this is where, if you're giving injections, a common site for drawing blood or giving injections, such as an injection for CT. Then the vein that goes over the radial bone is the radial vein. So if we're starting in our hand, we go radial, medial cubital, cephalic, subclavian, superior vena cava. Good. Now let's look at the inferior vena cava. The inferior vena cava will go down, collect blood from the lower part of the body. It collects the hepatic, the tissue, the blood from the hepatic, the liver, the hepatic vein will go into it. Then again, you have your dividing of at the level of the ilium. So you have the iliac, internal iliac, external iliac. On the other side, if we continue down, the one over the femur is femoral, popliteal behind the knee, fibular and tibial are on above the fibulas medial, and the anterior and posterior tibial are on the outside. Now there is one vein which to me makes no sense in terms of naming, and that is the greater saphenous vein. And it is when it comes off the iliac, external iliac, and it's a very surface vein going all the way down the leg to the ankle, and it collects in the feet. This is the most common vein that gets grafted or harvested in case you need a vein for, say, a coronary bypass. Also, this is one of the veins that have the problem of varicose veins. It's usually by this one. The whole thing about varicose veins is you can get this closed off or sealed off, but the blood has to go somewhere. So if you close off this vein by latex, or sometimes it's removed, the blood will go somewhere else, and eventually you will get your varicose veins back again. And that is the superficial veins of the body, the principal ones. Again, if it's on this diagram, it is testable. The last thing I want to look at in terms of blood vessels is the hepatic portal system. So the blood is collected off the digestive system, and the blood is ported to the liver. So do not mix the hepatic veins, which take the blood from the liver to the inferior vena cava, and the hepatic portal veins, which collect the blood off of the gut veins. So splenic comes from spleen, mesenteric comes from the top of the mesentery, inferior comes from the bottom of the mesentery, and they all collect and go via the portal system to the liver, where it has the first pass and gets detoxified and then continues on from there. That is a quick overview of all the blood vessels. Hopefully that will help you to remember the names. There is also the games with a purpose link on the doc so that you can drill these in, because it's a matching question. Luckily, you don't have to spell them. Good. That's it for vessels of the body.